having for you students, and you're in first semester, so most important thing is to have your medication, knowing how to figure it out. You can do it cognitively in your head, or you could figure it out. Now this is number 3. The patient who's had a total hip replacement requires heparin, 10,000 units sub-Q every 12 hours. So if you have heparin, 5,000 units per milliliter available, that means on hand, how many milliliters will you administer? So let's say you have the right syringe. We're going to be using sub-Q, which is 29 gauge. So can somebody tell me how many milliliters this would be? Go ahead.
Oh, I don't know, 3 milliliter syringe?
Exactly, but we're going to be giving 2 milliliters because 5,000 units is in 1 milliliter. So then at 10,000 you would give twice a dose. You can even do it in your head. That means 10,000 units sub-Q would be in 2 milliliters. So you want to use a 3 milliliter syringe because you don't want the plunger falling out with the medication, and you give it sub-Q. Okay, very good. Let's move on to assimilation because we're going to be inserting an NG tube. Okay, for NG insertion, students, the first thing that you want to do, of course, is to make sure there's a doctor's order, and then you have the right equipment. Now, a 14 or a 16 French, if it's an adult, smaller, and especially if it's going to be for suction, you're going to need a 14 or 16 French because students focus over here. You will get the tube, and it will be connected to the suction, and here's the gauge. You want to have intermittent suction for the patient's NG tube to remove anything in the stomach. But if it's for tube feeding, what we'll have to do is you'll order an x-ray to make sure it's in the stomach and not in the respiratory. So it's a clean procedure. It isn't sterile. We're going to the GI, and we want to remove the contents via the suction, depends on the doctor's order, or we're going to be giving tube feeding. Now this is a Salem sump tube. This is what's going to be going in the nasal pharynx, behind the oral pharynx, and in the esophagus. The patient will be swallowing, so it can follow through the esophagus and it won't go down the trach. So we'll have water, all the tools and everything, and we'll have the chin of the patient touching the chest. So then when it does go down, it will go through the esophagus into the stomach once the patient swallows. Now this Salem sump tube, this right here, we call this the pigtail. This basically is for air, and this keeps this very thin, has a lot of holes at the very bottom, and this is what the material, the GI material, comes up through the tube. So in this air vent prevents it from sucking along the mucus GI tract and causing bleeding. So it's very important to keep it patent, to keep it open. So basically this is what, if we were to give tube feeding medications, just like we gave earlier, heparin sub-Q, usually they give heparin IV or subcutaneously, and then we're going to give Coumadin PO. So to give Coumadin, you check the lab, blood lab, and make sure the PT and the INR is done. And when the level is okay, you crush the Coumadin pill and you insert it in here via a piston tube through gravity. So you would have your water-soluble lubricant, and you would put the chin down, and of course you would explain this to the patient, and you would check the ID, 2 identifiers, patient's birth date, you would ask them their name, and then you would explain it to the patient. You'd have the curtain pulled so that obviously the patient confidentiality and privacy would be very important, and then you explain it to the patient. If it's an adult, you can tell them that you need their cooperation for swallowing. If it's a child, you might want to have a syringe with water or juice. Now if they're NPO, you ask the doctor if you could just give a few cc's or a few milliliters of water, and you would insert it. Once the patient swallows and you see that, you can advance it through. Of course you want to measure it first. It's from the earlobe to the nose down to the xiphoid process. and then usually you'll mark it with either a felt pen or a piece of tape. You'll have the tape ready so that you can tape it in place, and you will have an x-ray taken to make sure it's in the correct, if it's in the stomach and it's not in the respiratory. But if they're not coughing and you see that they're able to talk, then you know it's not in the respiratory area. So once the x-ray is taken and it's in the right place, you would have this taped, and then you could give your tube feeding, which is the medication that goes in this port right here. Okay, any questions?
No.
Do you have any questions?
No questions.
Okay. Naturally, you want to have your patient in a 90-degree position, straight up, because, and the chin right on the chest is the secret. Once they swallow, you can advance it all the way down to the stomach and the esophagus. Yes? Question?
Why do you have to put the chin to the chest?
Well, what this does, it allows the trachea, which is in the front and the esophagus is behind it. The trachea collapses, and that way it's less, it lessens the chance for invertly going into the respiratory area via the trachea. So it kind of collapses and opens up the esophagus.
Okay, thank you.
Any other questions?
No.
Okay.